Hello, this is Dr. Michael Gott. I'm an orthopedic surgeon at Westchester Health Orthopedics and Sports Medicine. Like we have done in previous weeks, we're going to again highlight an injury that occurred this past Sunday that may affect your fantasy team. Ben Roethlisberger, the star quarterback for the Pittsburgh Steelers, suffered an injury to his knee this past Sunday. After MRI last night, it was confirmed he has an MCL sprain. He was very lucky based on the injury and looking at the actual film of it, where he could have injured much more structures in his knee, but an MCL sprain is probably the best case scenario for him. The MCL lives on the inside of the knee, or the medial collateral ligament. The LCL is on the outside, with the ACL and PCL being on the inside. But let's focus on the MCL and what it does. It provides stability on the inside of the knee to this type of motion, or side-to-side motion. It's very important for a quarterback who's planting and cutting to have this ligament intact. Now, there are different gradations and different types and severity of an MCL injury. Grade 1 through 3 is what we use. Grade 1 being an intact ligament, just barely sprained. Grade 2 being more moderate, where there is some laxity, but most of the fiber is intact. And grade 3 being a complete tear. Now, we don't have access to the actual MRI images, and there's no data or any news put out on the gradation of the tear, so that may affect a little bit exactly how we're going to be able to prognosticate his injury. But looking at the most recent data on professional athletes and MCL sprains, which is not actually in professional football players, but there's a large study that was done in professional soccer players, which was in the British Journal of Sports Medicine in 2013, which looked at 346 different MCL injuries over a 10-year period. Now, the good news is the mean return to play was 23 days, with a standard deviation of about 23. So it was between 8 and 40 days, but the mean was 23 days, which for Ben Roethlisberger, that would be about 3 or 4 weeks. The other thing that's important is that the severity of the injury didn't really affect, according to the study, how long it took them to get back. However, if he does in fact have a grade 3 or complete tear, it's definitely going to take him more than 4 weeks to come back. But based on some of the early news, it doesn't look like it is going to be a major tear, and it is just a sprain, so we could probably expect him to be able to come back within 3 or 4 weeks. He will come back in a brace, which will help him with some of the stability of his knee, but in the meantime, he'll be working on some things to get the swelling out of his knee, building up his quad strength, and maintaining his motion.